and now also leading the charge with getting the vaccine rolled out.
Whoever next can go ahead.
Hi, everyone. I'm really grateful to be here today. I just want to give a shout out to Pastor Porter and Nan for having me on this distinguished panel. Really humbled to be part of this event. So just thank you so much for inviting me. My name is Vang, and I am the Councilwoman for District 8. I represent the southern part of South Sacramento. Neighborhoods include Meadowview, Parkway, Cabrillo, Detroit, North Laguna Valley High. Just really grateful to be here today. I represent a district and zip code, actually, I like to call it out, 95823, with the highest cases of COVID in the city of Sacramento and the county. And so my team has been hustling with our incredible CBO partners on the ground and with the county to really make sure we meet the community where they're at. And we're hosting a vaccination clinic at the Bonnie Pannell Community Center every Friday now. It started as a one-day vaccination pop-up clinic, and with the support of community partners in the county, we are hustling to make sure that we continue to keep this clinic open. It is completely volunteer run, people-powered clinic with over 200 volunteers every Friday. And so just really grateful for that. And I know we'll have an opportunity to talk a little bit more, but just again, thank you so much for having me on today.
And I'm Dr. Noha Aboelata. I'm the CEO and founder at Roots Community Health Center. We're based in Oakland. We're also situated in the zip code with the highest case rates of COVID-19 as well. We were the first walk-up COVID site. We, back in April, started this, hard to believe, over a year now. And we're also now doing community vaccination. We've been doing contact tracing as well. So we've been really, our amazing team has been on the front lines of this pandemic, and just happy to be invited here today. And you did pretty well with my name, Pastor Aboelata.
Well, thank you, ladies, so much. Please forgive me. He did well with your name. Pray grace for me that I don't butcher it. And I know how it feels because my last name is Scarbrough, so it's been butchered many times over. Dr. Kasirye, if we could start with you. You've led the County of Sacramento in its vaccination efforts overall. Where are we now? And also, could you speak a little bit to communities of color? Are those communities keeping up with being vaccinated?
Sure. We're at over 103,000 cases of COVID-19 reported in Sacramento County. Fortunately, we are down from the high that we had where we're getting about 1,000 cases a day. We're getting about 100 a day now. But unfortunately, there's been a slowdown, so we are still in the red tier, which is still has substantial spread of the virus. And so still a ways to go. In terms of the impact that I have seen, especially for communities of color, I think one of the lessons that we have seen with COVID-19 is it has really unmasked some of the health inequities and the health disparities in our communities. Because when you look at the communities that were most greatly impacted, it was communities of color, underserved communities. And then when you look at the vaccine rollout, because of the way that the priorities were set up, it disadvantaged underserved communities because it was initially based on occupation. And we know that the occupations that we started off with, there is an underrepresentation of communities of color. And also because it was really based on, you had to have a computer and be able to log on and schedule an appointment. So we are really trying to work towards reducing that disparity, because as the numbers started rolling in, we realized that there was a huge disparity that had come up with the vaccinations. And now when you look at our numbers, even in Sacramento County, and this is true across California, those in the richer parts of the communities and those in what we call the health equity quartile 4, their vaccination rates are as high as 75% in some of the counties. And then you look in Sacramento County, and some of our counties are at less than 20% vaccination rates. So that is something that we need to fix, and that's where our focus has been. And of course, very glad to be able to work with Councilmember Vang and the volunteers in being able to bring the vaccine to the people.
Thank you so much for sharing that. If I could ask Dr. Aboelata, the Shot of Faith campaign has specifically targeted the Black church in an effort to reach Black and brown communities through the most trusted voices, which typically are our pastors and our church leaders. How will conversations that share information like this help dispel, eliminate, and possibly remove the distrust that so many of us who are still on the fence have about being vaccinated? How are these conversations going, if you could share to that?
Sure. These conversations are really critical. We have to be able to talk. We have to be able to talk with one another, share information, ask questions. There's a lot of really good questions that I get out of these conversations that shows that it's not just that people are rejecting it or saying, I don't want it. And I think that's an unfortunate narrative that's put out there. It's just that we are very careful and discerning patients, and we want information. So we deserve to have our questions answered, and not in a way that is judgmental or patronizing or overly simple or overly complicated. And so I think, and yet this is complicated stuff, right? This is not simple. And so I think it's important that we continue to have these conversations. I know for us, we said since the beginning of the vaccine rollout, like, we're going to be here for the long haul. We know that there's going to be a lot of efforts that pop up and that vaccinate large numbers of people, and that's wonderful. We absolutely need that. But there's going to be folks that need a little more time to digest the information and make the best decision for them. I think what's most important to me, and where the sense of urgency comes, is that we need to understand, what is the information that you need if you in order to make the best decision. And so getting credible information and knowing who you can trust to get that information from, I think is really, really important right now, to get the best understanding possible, so that you know what it is, what are the risks that you're weighing, what are the benefits that you're weighing, so that you can make the best decision for yourself and your family.
Thank you so much for sharing. That's very critical. And I know we've been having those conversations even in our churches here in Sacramento. So thank you so much for all that you're doing in that area. Councilwoman Vang, if I could ask you, you and your team are leading one of the largest pop-up vaccination clinics in Sacramento in an urban area. If you could speak to, one, why did you feel the need to fight to do this? Also, what have been the outcomes? And what have you learned in this effort in vaccinating communities of color?
Thank you so much for your question. Pre-COVID, I think many of us already knew that there were inequities that existed in our communities, right? Many of our families were already struggling prior to COVID. And we know, given the pandemic, these inequities have widened. We also know that we have a system that definitely discriminate, right? COVID doesn't discriminate. Everyone can get COVID, but we know the system that we have set up right now actually just leads to more inequities. And representing an area in a zip code with the highest cases of COVID, it was really important for me, one, to make sure that our families, our neighborhoods get access to all the resources they need, but most importantly, access to the vaccine, which is really, truly the light at the end of the tunnel. I had an opportunity to really advocate, but also work closely with Dr. Kasirye to really make the ask that we need to have a clinic right in the heart of South Sacramento in Meadowview, where we know COVID has really impacted our families. And Dr. Kasirye said, absolutely, let's do this one-day vaccination clinic. And then after that, we ended up keeping it every week. But I will say it takes people power to run this. All our volunteers, medical and non-medical, are all volunteers, no paid, right? The city actually have stepped up so that we could utilize the Panel Center and do everything we can to make sure that we get our community vaccinated. It is truly not just on the responsibility of the county, but also the city and all of our community partners. I also want to say, in my area in particular, our district has a high concentration of essential workers, folks who are not able to work remotely from home. And they're generally and high traffic public facing jobs, which is another reason why we have such a high rate in our district. We also live in multi-generational households, right? In Black, Latino, Southeast Asian. We have our seniors living with us, our elders. And so when one person is impacted by COVID, it spreads to the entire family. And that's another reason why we have such a high case. But I will say, what I've seen on the ground, I truly believe in the power of partnerships and the power of trusted messengers in our churches and our community-based organization. When we first held our community clinic on March 12th, it's not a coincidence that the stats that we had were amazing, that 90% of the residents that came in were from Black, Latino, Southeast Asian, Pacific Islander community, with 50% of the residents speaking limited English. There's a reason why, and it's because we worked with 14, 15 CDOs, some of them being churches, Genesis Church, South Sac Christian Center, Antioch, the NAACP. We worked with multiple partners to make sure that we were intentional about outreach, because we also know there's a digital divide as well, right? You can have registration online, but some folks might not be able to navigate the online system. And so it was important to make sure we had phone numbers ready to go in multiple languages so that folks can also feel comfortable to call to make an appointment. And so for our first vaccination clinic, we had over 90% of folks that identify as folks of color, with 50% limited English speakers. And I'm really proud of those numbers, but I can't take credit for it. I give all the mad props to our churches, to our CDO partners that made this possible. And I think the lesson learned, and I think it's a lesson that many of us know as grassroots organizers, is that one, you got to meet the people where they're at, and it's all about the trusted messenger. At the end of the day, government can try to, roll out vaccine, do what they can, but if you don't have the key partnerships on the ground, the trusted messenger, you won't be able to execute a plan. And I think you see that clearly with our vaccination clinic. And the reason why we've been successful is because really the backbone of these clinic is really our community-based organization and our churches that are doing the intentional outreach.
Wow, thank you so much for sharing. That's a lot of information. I'm glad you guys are sharing these things with us, because so many people watching and that will watch this don't know these things. And so if I could ask my brother, I call him my big brother, Dr. Porter, as a pastor and community leader, can you share why you feel it's so important for voices like yours, voices like ours, to partner with the county, the city, and even other organizations to ensure that our communities are vaccinated?
Sure. But first of all, I want to just thank our doctors and our council member, and for all of those who are on the front lines. They are on the front lines doing this work here, and it has not been easy. There's been no game plan to do this work. Nobody's been in a pandemic before, right? And so, at least not in our lifetime. So kudos to our good doctors and our councilwoman here. As for your question, the communities that we serve, Black and brown communities, this pandemic is only one piece of the puzzle. We've been hit really with a double or a triple pandemic. The pandemic has exacerbated the ills of our society, and whereas the inequity in our health, inequity in our job loss, our racial issues, and the list goes on, housing, education, small businesses, and it's impacted houses of faith. And so, recovery is just as important, if not more important, for Black and brown communities, because we've been so hit hard by the pandemic. Therefore, we should do just like we've heard here. You got to reach people where they're at using trusted voices. And so I've had the opportunity to partner with each of these organizations that you see on the screen through the county. We had a bi-weekly call. I was part one of those groups, one of the first groups who are striving for equity, COVID equity in our health, COVID equity in the CARES money that came through for our Black and brown small businesses, and then make sure we have vaccine equity for our Black and brown communities. And then the Shot of Faith program, they came and said, can you just lend your voice through the church? And I said, yes, of course, we can do that. Why? Because our communities need it. And I want to encourage any pastor. You know, you are not really pastoring if you just staying. You heard from Reverend Sharpton today. If you just preach an Old Testament, you need to go ahead and make it reality, because our people are suffering. Our congregations need help, and so and this is the road to recover. We will not recover if we don't stand up and say something and encourage our people to get the resources that are out there and fight for them. And so it was a no-brainer when Lisa Collins asked me to say something. It's no brainer when my Vang reached out and said do something. It's no brainer to hear and to follow the guidelines that Dr. Kasirye is saying for us to follow. And so we want to keep on doing that because our people need it. And I'm so glad that, you know, through this partnership, I've been able to get my family vaccinated and our congregation vaccinated. So I'm all for it. I'm all in.
Thank you, Dr. Porter. Question for all four of you, but I'm gonna split it up. The general question is this: what do you say to a person who currently refuses to receive the vaccine? Now, this is how I'm gonna split it up. Dr. Porter, if you could answer that for the person who refuses based upon spiritual reasons. God gonna heal me, the Holy Spirit gonna keep me, the Holy Ghost. Dr. Kasirye, if you could answer that in the sense for those who are the conspiracy theorists, those that, you know, we remember Tuskegee, they testing stuff on us. How would you respond to that person? Councilwoman Vang, if you could speak to the person that is refusing because they say, you know, I just don't need it. You know, what's the point? You know, it's going away. Why would I do it? And Dr. Aboelata, if you could speak to the person who it's political for them. You know, COVID doesn't exist. That's what the Democrats made up. So why would I even take that? You know, they just want to give me a shot so I can turn Republican. I actually have heard that one. I heard that one. And so if you guys could just, however you want to go, just answer. What would you say to that person? I know I'm throwing y'all on the spot, but that's the fun thing of these things being live, to throw you on the spot. So whoever wants to go first, go for it.
I'll go first. I think about the conversation I had with my mom. She was incredibly hesitant about taking the vaccine shot. And, you know, she's like, why do I need to do it? Other folks are taking it. And I said to her, my mom, I have 15 siblings, right? And a huge family. And I said to her, Mom, you know, I know you're a very selfless person, right? And so taking this vaccine is not just about you, but it's about protecting all of my siblings. It's about protecting grandma and grandpa. Because what if you're an asymptomatic carrier? You know, that could hurt someone, right? And I said to her, it's so important. Like, if this is not even just about you, Mom, it's about all my brothers and sisters, grandma and our aunties, right? And when I had that conversation with her, she was like, oh, okay, then I need to get it, right? I need to make sure that I get the vaccine shot. And that's the same, you know, when I'm having conversation with constituents as well, that's really about loving and caring for our neighbors and our families. At the end of the day, it's not just about us or me as an individual, but it's about a collective responsibility, right? We got to reach, I think they call it herd immunity, but I say community immunity, right? We got to get to that number. And we can only do that if we get folks vaccinated so we can reach that. So let's protect one another, because I know you love deeply your family and your community, as do I. And so let's do that together. And that's the conversation I usually have with folks, family and non-family or constituents, where they're hesitant or they're saying, hey, I'm not going to take it.
Thank you. Who else wants to jump in next?
I could go next. I think the first thing for us to acknowledge is the fact that our medical community does have a history that I don't think that we're very proud of. What happened was not right, and what is happening even now is not right, where people are treated differently based on the color of their skin. I think it starts with us acknowledging that a systemic racism does exist in the way that we provide care, and in a lot of the systems that services that are provided to people. And the way to be able to make that right is to see where the disparities are, to acknowledge where things have gone wrong, and to work together to correct them. So I think, and as I've been working with community-based agencies and working with the different groups, I always remind myself that I need to be humble and come as this is your community, this is your body. So I can come with all of the medical information that I have, but we need to work together in order to get to the point where we can have better health, where we can help healthier communities. And as we develop that trust, as we work with trusted messengers, as Councilmember mentioned, and working with also pastors, we've seen that it has been very impactful. And I think actually it was in a meeting that we were having with Pastor Porter and some of the members of his congregation, where we were talking about vaccine hesitancy. And one of the members said, if my pastor tells me it's okay, I will get the vaccine. And to me, that was like, there it is. It doesn't matter how much information I'm coming up with, but I need to work with the people. And in public health, that's what we are trying to do, is we come in with all of the information, but we come in partnership with you and, work with the trusted messengers so that we can get the message across. Yes, that history is there, but it doesn't need to remain the same. We know that these vaccines are impactful, they are effective, and I can show you the numbers to show you how effective it is. And so we need to take that one small step and towards healing, and then be able to work on other things as well.
Yeah, so you gave me the hardest one, the people who is political. They don't, if they don't think COVID exists, I can't even answer the question. I don't know what to do for you if at this point you think it's not real. But I think your question is well taken, because it has become very political, and this is something very new for me in healthcare, where something that is, a contagious disease has become politicized, and it's very unfortunate, and it makes all of our jobs, I think, much more challenging, because we're having to overcome that in addition to all the things I think that have been mentioned already. And so I would just say a couple things. One is I don't say anybody's refusing the vaccine. They're just not ready to get it yet. And we've seen that people who were, reluctant a few months ago, are coming around. And so I think the more people get it and the more they talk about it and why they got it, especially leaders in our community like yourselves, then it becomes more normalized, and people the fear starts to come down. Because I think a lot of even the conspiracy theories, the political piece, all of that, a lot of it is rooted in fear. This is a collective global trauma we're all going through, and it's something that is very frightening in terms of this invisible demon that is really, frankly, staying a step ahead of us this entire time. I mean, even until now, we are still seeing waves and surges around the world, and so I think that helping folks to really push past that fear. I even felt a little bit like, oh my gosh, okay, I'm about to go do this. But, because, it's natural to feel that way. This is all new. We haven't seen any of this before. And so I think helping people to push past the fear and the skepticism, I'm a very skeptical person. I mean, I created Roots in a lot of ways because I understand that systems have mistreated our community, and that you can't trust everything blindly, and we don't want people to trust blindly. I'm glad people are asking questions. I wish they would have asked as many questions before the opioid epidemic. I wish they would have asked as many questions for a lot of prescriptions that get written that are addictive or that have other pitfalls, right? So we have to be discerning, and we have to ask these questions. And so I encourage it. But when you start to get to the point of wanting to just say, I don't trust any of it, and throw it all out, now we start to expose ourselves to harm, to death, to things that are now preventable. I mean, that's the part that really, it's very sad to see anyone at this point die from a vaccine preventable illness. And now COVID, we can basically say, at least the type that we're dealing with now, is a vaccine preventable illness. And we don't want anyone to die from it. Right now, the risk of dying from COVID, if you're diagnosed with COVID, is about 1 in 56. And that hasn't changed almost since, July. So in other words, we're not really making big leaps and bounds in terms of figuring out how to treat this thing, because it affects like every organ system in the body. Is very unpredictable, right? And so I think what is the most important at this point is not to say, you just can't trust the pharmaceutical industry, or that, of course they're there to make money. We live in America. We understand these things. This is not new. This is nothing new, right? But what we need is the power to do our own critical thinking and to lean into experts that we can trust, and to figure out who those people are and to listen to them. Because what will happen if not is that we think we have bad disparities now. Based on my analysis and talking to a lot of experts in this, they only can get worse from here. The disparities can only get worse from here, right? Because as it was mentioned, if you're affluent, if you're white, you're much more likely to seek out that vaccine. So now that population is protected. And now our population, our community that's already disproportionately dying, disproportionately contracting it, disproportionately continuing to be in essential work and exposed, and is now unprotected, and now we're getting more contagious and more deadly variants, is now becoming more likely to be exposed and get sick and potentially die. And so the disparities only can get worse from here if we don't continue to do this work and help people to push past their fears. And the last thing I'll say is that I know we talk about the death, 1 in 56, risk of hospitalization, 1 in 20. These are not good numbers. But now it's looking like the risk of long COVID is about 1 in 3. That is very high. And long COVID is affecting all age groups basically at the same rate. So you don't want to be 25 and having all your hair fall out and getting winded when you try to run up the stairs. I mean, these are quality of life issues. And we are looking at a potentially high burden of chronic disease within our communities because of the effects and the long-term impacts of COVID. And so there's a number of reasons and a number of facts, but I think what's really important is to be able to sift through it all, because frankly, the conspiracy theories and the politicization and all of that is much louder than we are. And so we just got to get louder with the actual facts and information so that people can really cut through all that noise and get relevant information for them to make their best decisions.
Thank you so much, ladies, for answering that. Y'all each took a turn was preaching for a second, so we appreciate that. I don't know how Dr. Porter gonna follow all that, but go ahead, Doc.
I don't know I'm going to follow that either. But I just want to raise up one stat, and it's an old stat, honestly, but it's 500,000, right? 500,000 that has passed away from this disease. And I bet you in that 500,000, there are people that prayed, the people that went to church, that believed God, that practiced some type of faith or religion. And that within that 500,000, now their families have lost, these persons, throughout the globe and or through our nation. And so that tells us that this is not a matter of faith, if you will, in that regards. Our faith comes into believing in the gifts and talents that God has placed upon this earth to help us cure this disease through this vaccine. And I think that's the way we need to direct our messages through as persons of faith, regardless of what it is, to say that God has given us persons, people, medical doctors that we see here, people who are on the ground to help out, that can use, to say, listen, God uses them to help us heal ourselves. And so I think that's the way we need to address the issue of our faith. Of course, there's other issues of religion and practices that say, well, I don't know if I'm going to take the J&J, vaccine because of the issues I have that in my religious practice. And I would say, just really it's an individual decision, but I would say, but look hard, listen closely, talk to your medical person, your doctor that you trust. And if they say take it, and then pray about it later.
Thank you so much. One quick general question, and I think we're going to open up for questions for those that are online that may have some. But one question for either of our medical doctors. some people have taken the first shot, but we're hearing that a lot of people are not taking the second shot. Can either of you speak to whether this is okay? Does this pose a danger? Does this nullify the first shot? Like, what are the health consequences and even the sociological impact of these things?
This is a great question, and it is an increasing concern. So I'll just start by saying, the studies were only done on really the 2 shots at the spacing, the interval that, and so when we say how effective it is, that's what we're talking about, is the 2 shots at the interval that it is recommended, either 3 weeks for the Pfizer or 4 weeks for the Moderna. And so if you miss, your second shot, then you should still get it, even if it's later. In order to get that boost, if you will, to make sure that you're getting the better protection. The 1 dose, everybody's a little bit different. And so it may be, very weak and do nothing at all. It may do a little bit of something. We don't know. There hasn't been studies on that, and that's not recommended. So it's really like you didn't do the whole thing. I mean, you just didn't do the whole thing that was needed to get you where we needed to get you. You just didn't. So, and it's not too late to just do it now, to get it done. And so I think it's important for us to try to find out why that's happening. We're not seeing that to that extent at our site, but when we call people, we oftentimes find out, okay, I got the second shot, closer to home or something of that nature. And so I think we want to verify and make sure. I would like to believe that it's not happening at the rate we think, just simply because there's so many sites to get it that some people are choosing to get them at different places. So that's what I'm hoping is the case, because we do not want, in general, I'm going to just speak generally now, we don't want partial immunity to anything, because what that does is it creates a situation where we could be encouraging more mutations and more variants, because you basically can still end up getting infected and, even having longer term infections. We really don't know all the things that can happen. That's why we just want you to be completely protected as much as possible from getting it at all. So I don't want to get too theoretical about what could happen if we have a bunch of partially immune people out there. But I think that is a concern, and that's the same reason why, even if you've had COVID-19, we want you to still get vaccinated, because that also, we don't know that gives you enough immunity to really help to neutralize it if you get it. And so, I mean, this is one of those areas where you would need to really do a research study to say what percentage of people get protected with just 1 shot, but it was not enough in the original trials. Those trials were done. A big portion of the phases of the trial is to establish what doses do you need. And this is what they established is what you need. So you just basically just only did a part of it. And so all bets are off, so to speak. And so you're halfway there. And so, go on and just get the second one. And the other thing I would say for people who haven't gotten it yet is when you sign up to get an mRNA vaccine, you are signing up for both doses. I mean, that's what we're letting people know. You are committing and signing up to both doses. And I take that personal responsibility for saying, we have to complete it. You can't just do a part of it. So go ahead and make that commitment in your mind. It's not like a buffet. you gotta do the whole thing.
So just to add on to that, what I do tell people is that from the studies that were done, both of those vaccines are over 90% protective. But in order to get that full protection, you have to have both doses. So usually I just say 1 shot is better than none, but 2 is even better. So it's really important that you complete it, and so that you get the full protection from both doses. From the data that we have, we know the good thing is that the majority of people are actually going ahead and getting both shots. Sometimes there is a delay, but they still get it within the 6-week period. So we still need to work on that small percentage that either choose not to or forget, so that we can send them reminders and get them to get the second shot as well.
Thank you so much. Are we able to do the questions from those that are watching online? Okay, we're gonna check while they check that. Those of you that are watching, please make sure if you are on the fence and you've gotten the first one, please make sure you get your second dose. It's almost like left Twix and right Twix. You don't just eat the left Twix, you also eat the right Twix. So treat it like that. Take both of your Twix. And until then, if I can ask you, Councilmember Vang. Oh, you're gonna put it, okay. Can you see him? I can't see him either. Councilwoman Vang, can you speak to how do you see this pandemic changing how we govern and how we lead our cities from a political place? How do you see this changing things as we go forward into the future?
Well, let me just say pre-COVID, every government should always focus their resources on communities often left behind and most vulnerable. And I don't think that should change even in the pandemic, right? That when we think about the CARES dollars that come in and the American Rescue Plan that's coming in into our local government, we have to make sure that those resources and those support goes to communities hardest hit. That has always been my priority, whether it's pre-COVID or now, and that should be the priority of all governments. If we truly are to have a successful city, a successful state and country, we have to make sure that we're supporting those most left behind and those that are most, that's bearing the brunt of all the devastating impacts. And so I would say to all elected officials, that has to be our focus. If we're talking about recovery and ensuring that families and neighborhoods and cities come out of this stronger, healthier, and happier, we got to make sure that we don't leave those communities behind. They've been left behind already pre-COVID, and now we don't step up right now, we're going to see the long-term outcomes of the harm and trauma of the disparities that will continue to persist. And so that should have been the priority prior to COVID, and it should continue to be the priority to make sure we get those resources to our communities.
Thank you so much. Similar question, Dr. Porter. How do you see the pandemic things changing the church, especially the Black church and brown churches? How do you see that impacting us as we go further into the future?
Yeah. Well, one, we're going to see who actually survives this. After a year of not being able to come together, it's really hurt a lot of our Black and brown churches. We've had some that had to close down, shut down, at least physically, and make the transition over to a more online presence. And then moving forward, it's going to be all about the hybrid style, as people are still trying to wrap their minds around coming back and congregating. There is a trauma to this, to COVID here. And so people are not going to be comfortable in crowds as much as possible. And that means even in our churches. And so now it's all about how do we accommodate an online presence or online church with a physical church. And I think that's we're going to be wrestling with that from now on, where we have to be a hybrid church in this space. I always look at these things as a great opportunity for us here to enter into this space. Got to say one more thing about that, because now faith is not just parked into a certain geographical place. Now you can practice your faith at any time, not just on Sunday, but you can catch it virtually in anywhere. So now I can watch my favorite preacher church from Canada or Las Vegas or wherever. Not Las Vegas probably, but anyways, you know what I mean. So you've got to deal with these various variables that we had to deal with before. I always look at these things as opportunities, though.
I know there was a question you kind of had on your heart you want to throw out there. You want to throw it out there now?
So we are talking about getting back to normal. Are we ever going to get back to normal? I want to hear this from the doctors, because this is what we're always asked.
Please say yes. Please say yes.
Reopening, what's happening with that?
I'm going to let the public health person answer that. The health officer answer that question.
Yeah, I believe that eventually we will, but it will take time, and we have to be patient. If we try to hurry this along and we start having these large gatherings with, people who are unmasked and not vaccinated, we could easily have an outbreak. So definitely there's a light at the end of the tunnel. And definitely we've made a lot of progress. But I think we still need to be careful. We need to be cautious. And yes, there will come a time. I don't know when. I'm hoping it will be soon, maybe early next year, but it will come. I took some time to read about the 1918 influenza pandemic and the devastation that caused. And just reading the stories, it seemed like they felt like they would never get back to normal, but they did. I think there were lessons learned then. I'm hoping there are lessons that we have learned this time around, because experts tell us that we need to be prepared because another pandemic will come at some point. And if we haven't learned our lessons now, we're bound to be repeating the same mistakes.
Thank you so much. We actually had a question come in. And you may have spoke to some of this already, but if you could, for this particular person, they are asking, with all the backlash and concerns about the vaccine, do you all still confidently recommend it?
100%, yes. I know that it is effective. And just to give you an example, during the past surges, we had huge outbreaks in the long-term care facilities, huge outbreaks, lots of deaths. But once we started vaccinating in the long-term care facilities, the numbers dropped dramatically. And even during this time when our numbers started climbing a bit, they got to a point where they plateaued. And it's because they were not getting to the older people, because the older people were protected. I recommend it for everybody unless you have a medical reason not to get the vaccine.
Yeah, without hesitation. The data is just too compelling. And so, you really are taking a gamble. I say playing Russian roulette with COVID. If you're going out there unvaccinated and you actually have a way to prevent it that we know is effective, we know is safe, there's actually very, very few conditions that would cause a concern for getting COVID. If you have concerns about that, you should ask your doctor. But for the most part, the questions I get, I have, diabetes, I'm taking medications, is it safe for me to get the vaccine? Absolutely. We actually wanted you at the front of the line with the vaccine. So the majority of people with medical conditions are actually the ones that are likely to do poorly if they catch COVID. And so they're the first people that need to be getting the vaccination. And so absolutely, if you're eligible for it, we know it works. And we also know that COVID is devastating and when we can prevent it.
Councilwoman, this might be more in your wheelhouse. Another question from online. Do you think educators have a different responsibility to be vaccinated?
I think everyone has a collective responsibility to be vaccinated. I think that includes our educators, that includes everyone. So I wouldn't just say that it is a responsibility just educators. I would say yes, everyone, just like you heard from the doctors, everyone should be vaccinated. So yeah, I don't have a priority in like who should. Obviously we have the public health tiers, our elders, seniors who are more prone, right? But in terms of just workers, everyone, it's a collaborative effort. Everyone, if we're going to reach herd immunity, that means everyone will have to step up. So
thank you so much. I don't know if we have any more. I think that's it for now. So, ladies, if you could each take a minute or two and just kind of give your closing thoughts and remarks, and then Dr. Porter yours, and then I'll close us out. So whoever wants to go first, if you can just start with your closing remarks, and we'll go as we draw to a conclusion in this conversation.
I haven't unmuted my mic, so I'll go first. I just want to say thank you so much again to Pastor Porter and Nan for having me here today. I think it's spaces like this and conferences and conversations like this is very much needed, right? We talk about education, we talk about making sure we protect our communities, and it starts with conversations such as this. And so I want to just really thank all of you and all the organizers behind the stage, because I know it takes a lot of work to put something like this on. I want to thank all of you that this work is very important. I see it as part of COVID recovery, the road to recovery, right? This conference is part of that, the road to recovery. And so I want to give a shout out just to you, Pastor Porter, and everyone, the team, for making this happen. And the last I'll leave off the last note is to make sure that you still mask up, that you still wash your hands, right? It's like the basic. Make sure you do those things. That's in addition to being vaccinated. Good hygiene goes a long way as well. So just want to make sure I say that, and just sending lots of love and healing your way. So thank you so much again for having me.
Yeah, I will just say I do think these conversations are critical. Keep talking, keep having the conversations, keep open to data and to information. And especially if you've not gotten vaccinated yet, ask yourself, what am I waiting for? What information do I need? And get that information for yourself. And in the meantime, we do still have COVID circulating. It's less, but it's still circulating. And we're having more and more variants on the scene that we need to be worried about. So if you're unvaccinated and you get exposed or you get symptoms, please do get tested. You may even be eligible for outpatient treatment that can help halt the progression of COVID. A lot of people don't know about it. If you're sick enough to get admitted to the hospital, you're no longer eligible for it. So the only way you'll know is if you get tested and if you ask your physician if you are eligible for it. And so, of course, we want to encourage people to get the vaccine. That's really the ultimate way that we prevent it and the way that we get out of this pandemic. There's not another way out. I think that's the biggest thing to say. There just isn't. I wish there was. I really do. There just isn't. And so that's really the sort of the choices that are before us. But in the meantime, just like the Councilwoman said, we have to do the basics. We have to mask. We have to space. Avoid crowded indoor spaces that are not well ventilated, and take good care of yourself. You can take a multivitamin, take your vitamin D, get a good night's sleep, keep your stress at bay. And those are all just good things in general. And also, last thing, I always have to make a plug for primary care. If you have chronic illnesses you haven't checked on lately, if you haven't had your blood pressure, your sugar, your cholesterol, those things checked out, because I know a lot of people have been avoiding the doctor. Now is a good time to make sure that you're just taking care of your overall health in general, and go ahead and broach that conversation with your doctor if you haven't gotten the vaccine yet either. It's so important to be established with good primary care, because people are dying not only of COVID, but in an excess manner of all the other things. So let's make sure that we take care of ourselves, take care of each other, and keep having those conversations.
Yeah, and I just want to thank Nan and Dr. Porter for the opportunity to speak. I also agree that these conversations are very important, and I try to make myself available to be able to answer questions. I think what's really important is for us to realize that each of us has a role to play. Each of us needs to do our part in order for us to be able to get through this. We're going to get through it together. And then, we also still need to look at, the road to recovery beyond COVID-19. What else do we need to look at? People have lost their jobs. People have lost their homes. People have lost loved ones. And as a community, we need to come together and be able to help people to heal and be able to help people to recover. But it all starts with us being able to get the shot so that we can get past this pandemic. So thank you again.
Well, thank you all for joining us. I just want to say, get vaccinated. I got the shot, and Moderna. I think that's the one with all the side effects. Anyways, I got it, and I'm glad I did. I say pray and take the shot. Pray and take the shot, whatever it is. Go ahead and do that. It was striking. A doctor from Oakland, she said that there's no other way out. So I think we need to really hear that and listen to that, take it to heart. and understand this is our road. The vaccine is our road to recovery health-wise, and you can't attack anything else if you're not healthy. So pray, get healthy. Let's listen to these trusted voices here. Get the shot and continue to do the work so that we all can heal and recover.
Thank you guys so much. Those of you that are watching, if we could close with, share a story with you guys. When I was about 17, I went on what was probably a life-changing experience that day. Dr. Porter, I was on the way to my first date with my father's car. And we were going to Six Flags Great America. And fine sister, I was excited, looking forward to enjoying life. She wanted to go to Six Flags. That's where we were going. I remember on the way there, the road to Six Flags, there were potholes. There were police officers on the side. There was an accident or two that we passed. A couple of times we hit traffic. The road to Six Flags was full of all kind of crazy stuff. But I was determined to get to where she wanted to go. And I think as we consider this road to recovery, we have to ask who and what that we value that's in the passenger seat of our lives, and where normalcy and these things, these goals that we're trying to get to, if these things are of value and these people are of value, we have to endure the potholes in the road. We have to endure the police. We got to endure all these things that come on this path. And so I would encourage all of you to critically think about who you value, what you value that's in the passenger seat of your lives, and the goal you're trying to get to, and strongly consider that this vaccine, social distancing, and all these things we don't care for are just part of the road to that recovery. So thank you so much for being part of us, our journey today, our conversations. Ladies, thank you so much for your time. We so appreciate it. We hand clap you. Those online, we air clap you for being with us. Love you guys so much. As we conclude this session, see you later. See you tomorrow. See you later on. Something we got a whole bunch going on.
Tonight, 7 p.m.
7 p.m.
We're going to come back so you can go ahead and get you a chicken dinner now. Instead of chicken salad. Get a chicken dinner.
Get a salad,
but
too,
we have a
because you need some
Revival
greens.
Night on tonight with Reverend Jonathan Mosley, Western Regional Director of National Action Network, Reverend Davis Toon, who is our National Field Coordinator, and our special guest speaker all the way from Atlanta, Georgia, the Right Reverend Jamal Harrison Bryant will be giving us our sermon on this evening. You don't want to miss it at 7 p.m. Thank you, ladies, for joining us on today. God bless you.
Peace.